One more thing about hand, foot, mouth is that it's not uncommon a couple of weeks, few weeks after having hand, foot, and mouth, believe it or not, for the nails to completely fall off. So this is just something that we see that almost invariably those fingernails or toenails are going to come back. They're going to grow back just fine. But something about this virus, especially if the kids have it on their hands and feet, but even when they don't, sometimes you will notice a couple weeks later those fingernails or toenails falling off. And it can start by looking like just like a line across this part of the nail. I have a photo here that a patient happily shared with me that was after this child had hand, foot, and mouth, and she contacted me because of these odd lines, these white lines in the middle of the baby's going horizontally across the baby's nail. And I said, you know what? I bet that is the very beginning of these nails separating from the finger and from the cuticle and the nail plate and getting ready to fall off. And lo and behold, that's what ended up happening. So I don't want you to be surprised or shocked if you start to notice that a few weeks after your child has the illness, or if you notice fingernails falling off all of a sudden, think back to, gosh, did they have a fever that we couldn't really explain for a couple of days a few weeks ago? Maybe that's what it was. Now, of course, if there's something unusual going on with it or those nails aren't growing back, then certainly reach out to your medical professional, your healthcare professional, doc to investigate. But really common sequela or consequence of hand, foot, mouth.